If you've been looking into psychedelic therapy, you've probably heard two names pretty much more than any others, psilocybin and ketamine. And I imagine you might have wondered, okay, what's happening with these two? Are they the same? Are they different? How are they the same? How are they different? Which one is right for me and how do they work? In this video, I'm going to answer all of those things. The short answer is they're doing a very similar thing, but from very different directions. I'm Clayton Nickus. I'm Colorado's first fully licensed natural medicine clinical facilitator, and I work with both of these medicines in my private therapy practice. And today I'm going to walk you through the real differences, what each one does to the brain, what they feel like, and what the research actually says about when to use which. The first thing to understand about these two drugs is that they're not in the same category at all. We call both of them psychedelics, but it's debatable whether or not ketamine even really is a psychedelic. It functions very differently. It's in a totally different category than psilocybin and even has a different mechanism. So psilocybin is a very classic psychedelic. It's in the same category as LSD, tryptamine. It works primarily through your brain's serotonin system, which regulates mood, emotion, perception. When you take psilocybin subjectively, what basically does is turn the volume up on everything that you're experiencing. It turns the volume up on your inner world. It increases functional connectivity in the brain, so it allows parts of the brain that don't typically communicate to talk. And it makes your internal experiences, thoughts, emotions, sensations, memories, images, a lot more vivid. Ketamine, on the other hand, is in the category of anesthetic dissociatives. Very different. Whether it even belongs in the category of psychedelics is something that's debatable. It works through a completely different brain system. Instead of turning the volume up on your inner experience, ketamine sort of temporarily fades everything out. It interrupts your brain's usual pattern of communication, and it does trigger a short-term burst of new neural connections, but it's not quite the same level of functional connectivity of psilocybin. Both medicines do help you form new connections in the brain and break out of entrenched, kind of intractable patterns, but they're getting there through pretty different doors. Psilocybin amplifies connection to what's happening inside of you, turns the volume up. Ketamine temporarily zooms you out or disconnects you from your ordinary way of experiencing things. And this is the simplest way that I can describe what it's actually like to be in these experiences. It's a metaphor, and like all metaphors, it's not perfect, but I think it's pretty good. I think it sort of gets to the core of the differences and the similarities between these two substances. Psilocybin zooms you in, and ketamine zooms you out. When you're zoomed in, you have a really close look at the object of your life. You can see the fine detail. You can see the scroll work, if you will. You can see every little speck. You know what you're dealing with, right? Psilocybin brings you towards your experience. And from that close distance, you can see what's happening. Ketamine brings you away. Ketamine zooms out. You take a step back from reality, from what it is that you're experiencing. And from that further distance, you can get more perspective. You see the object more clearly. So psilocybin brings you directly towards what you're dealing with. It shows you the fine detail of your life, your relationships, your emotions, your patterns, your pain. Colors become more saturated. Emotions become more accessible. Memories can surface with a lot of clarity. Things from the past can feel present. You don't really get distance from your experience. You get closeness with it. Psilocybin gives your internal world more presence, more salience, and more weight. Psilocybin has this funny way of taking things that you've been avoiding, that you don't want to look at, and bringing them into the foreground. So if you've habitually been turning away from something, shame, anger, grief, maybe a specific memory that you've pushed away, psilocybin has a tendency to bring you into a face-to-face interaction with that thing. And that's what makes it so therapeutically useful, actually. It might sound a little scary or a little bit challenging, but the cessation of experiential avoidance, the ability of the medicine to help us face those things that we've been turning away from, is a part of what makes it helpful in healing. Ketamine does something almost opposite to that. It creates distance. It gives you space, or maybe it puts you in space. The experience is really dreamlike. It can feel ethereal and floaty and kind of gooey. Everything gets sort of flexible and strange. The world can feel like it's made out of silly putty or something. Your internal thoughts and experience can be flexible in a way that it isn't typically. So emotions are still present, but there's sort of a numbness. Things feel less immediate, less gripping. Reality is still reality. Things are still the way that they are with ketamine, but there's just sort of this space from it all. So, like I said, both medicines can help you see the bigger picture of what's happening in your life, and they just get there from opposite directions. Psilocybin zooms you in, and ketamine zooms you out. Neither direction is inherently better. They just sort of serve different needs at different moments for different people. Some people could really benefit from the up close experience. They're ready for it. It's tolerable for them. There's the ability to handle anxiety, the ability to handle difficulty, the ability to really get up close and personal with what it is you're experiencing. Other people might benefit from a little bit of distance. For these people, it might be helpful to regulate a little bit, to get a little more spaciousness. And that is one of the differences between ketamine and psilocybin. People who have a hard time regulating their nervous system, or who carry a lot of internal fear and anxiety, don't really have the ability to begin meeting sensation and emotion, may not be a good fit for psilocybin, but could be a really good fit for ketamine. Beyond the subjective qualities, there are other practical, logistical differences between ketamine and psilocybin that make a pretty big difference. My psilocybin sessions are 7 hours long. The come up onset takes about 20 to 60 minutes. Peak lasts about 2 hours, and the come down is sort of this slow, gradual wave down. It's an intensive experience, psychologically, emotionally, sometimes physically, because what the medicine brings up, whatever it is what the work looks like. Everything that happens in session is to be faced, is to be turned towards, is to be worked with, and there's no fast forward or skip button throughout those 7 hours. My ketamine sessions that I offer in my practice, on the other hand, last about 2 hours total, and the effects of the ketamine itself are contained within those 2 hours, typically about 70 minutes or so, depending on the route of administration and the dose. In my practice, I work with sublingual psycholytic doses of ketamine. So these are lozenges or troches, and they take a little bit longer to come on, maybe 10 or 15 minutes. In other practices and other settings, they do work with IM, intramuscular, or IV ketamine, and that comes on almost instantly. With ketamine, you can be functional more or less the same day. With psilocybin, even after that 7-hour session ends, people are typically in a bit of an altered state. With ketamine, that altered state is cut much shorter, and you still can't drive after either session. But with ketamine, you might be a little more introspective, but relatively back to baseline. Psilocybin tends to leave people hovering a little bit above baseline, to leave people still in a slightly altered state of consciousness for some hours, even following the end of session. That difference in duration between psilocybin and ketamine actually reflects how they work therapeutically. Psilocybin's longer window gives you time to sit with a memory, to feel an emotion all the way through. Throughout those 7 hours, there's lots of opportunity to do the internal work of facing those things that you might have been avoiding. Ketamine has a much shorter window. Generally, it's less intensive. It asks less of the person who's going to be taking it, of the journeyer. It's sort of, you set an intention, you go in, you have the experience, maybe you receive some insight, and you come back. It's a little bit more straightforward. Certainly takes less time, where psilocybin can be kind of longer and meandering, a little bit less straightforward. For people who are new to altered states of consciousness and don't have a lot of experience moving to different places in their mind or navigating altered states, ketamine could be a better fit. It's a gentler entry point, but that doesn't mean that psilocybin is a bad option, even if you've never had a psychedelic experience. Psilocybin can be a really great first psychedelic experience, especially in a clinical or facilitated setting. And there's a difference that I've talked about in these videos before that I just want to mention again here. Doing therapeutic work with the medicine is not the same as just dosing on the medicine. There's a difference between psychedelic-assisted therapy and psychedelic treatments. So with ketamine treatments, sometimes these are called ketamine infusions. This is what most clinics offer. They're not actually offering ketamine-assisted therapy. With ketamine treatments or ketamine infusions, You sit in a room, you receive the ketamine, maybe it's an injection, maybe it's a nasal spray, and you have the experience largely on your own. There's typically a medical professional, like a nurse, who monitors your vitals, but there's usually no therapist present during the session. Often you're alone in the room. That is not psychedelic therapy. No one's helping you process what comes up in these infusion sessions. No one's supporting you in integration afterwards. Some places are different, but typically with ketamine treatments or psychedelic treatments, you receive the drug and you go on your way because it's all about the drug. And that model is very different than ketamine assisted therapy or psychedelic assisted therapy. So with ketamine assisted therapy, I use a relational model. The doses are lower and we feather the edge of consciousness. So you're in an altered state, but you're also present in the room. And a therapist, such as myself, who's trained in working with this state, is present with you through the whole experience. We help you prepare beforehand. We hold space during the session, but more than holding space, we sort of gently inquire. We help you navigate the realm, especially in psycholytic sessions. And it has 4 phases, which is initial consultation or screening, preparation, dosing, and integration. And I want to further this distinction a little bit more. Even the phrase supportive presence can be a little bit misleading. Having someone in the room with you is not exactly the same as therapy. A warm body just monitoring vitals while you lay on a couch is not the same as a trained psychedelic professional who understands your history, who can recognize when you're dissociating or distracting versus when you're processing, who can intervene skillfully when things get difficult, and who can help you make meaning of what you experienced and reflect that experience back to you in the days and the weeks following the session. Pure presence is wonderful, but it's not therapy. Psychedelic assisted therapy involves pure abiding presence, but there's more happening there than just purely being present. Psilocybin, the way that we do it in the Colorado regulated model, is structured from the beginning. It has those 4 phases: consultation, preparation, dosing, and integration. A licensed facilitator is present with you through the entire session, which, like I said, runs typically 7 hours. In this model, a relationship with a professional isn't an add-on. It's not something that you just happen across because you're doing the substance. The relationship with the facilitator, with the therapist, is really central to the experience. And because of that, this facilitator model in Colorado, even if you don't have a clinical facilitator, is closer to psychedelic assisted therapy than what they offer in ketamine infusion clinics. So let's take a look at the data. Ketamine has one major clinical advantage over psilocybin, which is speed. It does and can produce measurable reductions in depression symptoms within an hour or so of a single infusion. So for people in crisis with severe treatment-resistant depression or suicidal ideation, that speed could be really helpful and potentially life-saving. We don't have other interventions that work as fast. With psilocybin, we do have the preparation sessions. It's not something that you can necessarily just pop in for and pop out. Ketamine can be more of like a quick hit type thing, but the trade-off is the amount of time that it actually works. So after a single ketamine infusion, the median time to relapse is only about 2 to 4 weeks. The benefits of ketamine tend to fade pretty quickly, which is why ketamine infusions or ketamine therapy typically involves a series of sessions, usually 6 over the course of a couple weeks. And a lot of people require maintenance even beyond that. Psilocybin is a pretty different profile. Even though it's not yet FDA approved, it has received breakthrough therapy designation for treatment-resistant depression, but the durability data is much better than ketamine. So we know that after just 2 psilocybin therapy sessions, 71% of people saw major depression decreases, and 58% of those people no longer qualified for a diagnosis of major depression, even a full year later. So big difference from ketamine. With ketamine, 1 session could maybe last 2 to 3 weeks. With psilocybin, we have 1 or 2 sessions lasting up to a year, or maybe even more. There was another study that looked at severely depressed people who no longer qualified for a diagnosis of depression 2 years after a single psilocybin session. And there was another study that was a 5-year follow-up on those participants, and what they found was that 67% of them still didn't qualify for a diagnosis of depression 5 years later. So we have some evidence that suggests a single psilocybin session, though it is 7 hours long, much longer than the 2-hour ketamine session, the effects seem to be way more durable, last way longer than ketamine. So in plain terms, ketamine requires 6 or more sessions and often needs maintenance doses. Psilocybin, on the other hand, produces comparable results or even greater results in 1 or 2 sessions that can last for much longer, up to 5 years, as far as we know. There's another interesting difference here that it's worth mentioning, which is the subjective experience. With ketamine, the subjective experience, the subjective intensity seems to matter a little bit less than it does with psilocybin. There was a meta-analysis published in Nature which said that the subjective intensity of the experience mediated or controlled about 24% of the therapeutic outcome. So what that means is that what you feel during the session is predictive of the benefits that you'll receive later. The intensity of the session is predictive of benefits. With ketamine, the subjective intensity only mediated 5 to 10% of the effect. So there's a difference there. What this suggests is that the psilocybin experience itself is therapeutic. The psychedelic experience is therapeutic. The insights, the emotional breakthroughs, confrontation with avoided material, these aren't sort of side effects that we might want to get rid of through something like a neuroplastogen, which are drugs that are supposed to be like psychedelics but not have the psychedelic experience. That's a fool's errand, I'm going to tell you right now. The psychedelic experience is the treatment. With ketamine, it's a little bit different. With ketamine, it does seem like the therapeutic effects are more purely pharmacological rather than experiential. So ketamine might be more about what's happening in your brain chemistry than the subjective experience. So which one is more right for you? I'm not going to tell you because I couldn't possibly. I have no idea what your specific situation is, and it's very context dependent. It depends on your clinical picture, your life picture, your readiness, your willingness, these sorts of things. But I can give you some frameworks and general ideas. You might consider ketamine if you're in a very acute crisis and you need immediate rapid relief. If you're dealing with treatment-resistant depression, you're on a bunch of antidepressants and you need something better than what the antidepressants are offering. If you want a shorter, more contained, more manageable experience as sort of an entry point to altered states of consciousness and psychedelic therapy, and if psilocybin is not accessible to you, then ketamine could be a good choice. But if you do go the ketamine route, pay attention to the model of care. Like I said, there's a difference between relational psychedelic assisted therapy and ketamine infusions. If you have complex PTSD, if you have deep relational wounds or the tendency to become incredibly dysregulated and not be able to manage your emotions, then ketamine infusions could potentially be difficult for you. Whereas ketamine-assisted therapy, where there's a trained professional in the room with you, might be a better fit than an infusion clinic where you just take the drug by yourself. For people whose depression and challenges are not rooted in complex relational wounds, then standalone ketamine infusions as such could be adequate and appropriate depending on where you get them and what's happening for you. But typically, the more complex your history, the more the therapeutic relationship matters. You might consider psilocybin if it's available and if it's accessible to you, if you want deeper, more intense emotional work, if you're looking for lasting change from fewer sessions, if experiential avoidance, which is the habit of running from your internal experience, is really a core aspect of what's keeping you stuck. You might consider psilocybin if you want to work directly with the material rather than getting distance from it. If you feel ready and willing to open to work with, to face what's happening inside of you in a big way, then psilocybin could be a great fit. Ketamine you could start with to dip your toe into psychedelic work, to altered states of consciousness work, and then you can move into psilocybin depending on how you tolerated the ketamine. And a skilled psychedelic provider can have conversations with you that can help you determine which feels like the better fit. Okay, thank you for watching. Thank you for listening. If you found this interesting or helpful at all, please subscribe for regular videos on psychedelic assisted therapy.